So I just want to give a little a very warm welcome to Toby and a big thank you for agreeing to speak. Toby's got a pretty amazing CV. He's worked for more than 15 years in the public and voluntary sector in the UK in both policy and delivery roles. And he's currently seconded from Northumbria University to the Centre for Public Impact, CPI, you'll see it abbreviated to, where he's working alongside public and voluntary sector organisations to develop an alternative paradigm for public management, which enables public services to work more effectively in complex dynamic environments, really recognising that if we just keep doing what we've always done, the adage goes, we'll always get what we've always got. We need to behave differently in working in complex operating environments. And so Toby's going to share his approach with us, and then our two guest speakers are going to present case studies on how they've been applying some of this. So Toby, Visiting Professor of Public Management, warm welcome, over to you.
Thank you very much indeed, Elizabeth. Now let me just press some buttons. Grant, thank you so much for that introduction. So as Elizabeth was saying, I am a visiting professor at the Centre for Public Impact on secondment from Newcastle Business School at Northumbria, and what that means is that I do action research with all sorts of different public service organisations around the world to help them explore different ways of doing public management. And that's what I kind of really want to talk with you about today. The kind of questions that animate me are how can public service help people to create real outcomes in their lives, and most crucially, how should it be managed to enable that? So in order to respond to some of those questions, I'm going to talk through this time aside this question of how is an outcome made. I'm going to look at learning as a management strategy as a way to enact some of those ideas. Briefly touch on how we can use data for improvement purposes and the relationship between human learning systems and quality improvement and quality management, and then think about just offer you some resources if you want to do some of this for yourselves. So I suppose my key message is that if we want to achieve real outcomes, then we need to do public management very differently. I heard a board member at an ICB in the Southwest say a really, really brilliant line the other day. He said, "We're addicted to tried and tested ways of failing." And our current way of doing public management, we've been testing hard for the last 30, 40 years, and it consistently fails in exactly the same way every single time. So what does an alternative look like? In order to begin that conversation, what this I think is maybe a helpful shared starting point, that the purpose of public service is to help people to create good outcomes in their lives. I think this is like a pretty uncontroversial statement, all right? We would all say this is what public service is here to do. So if we all agree that this is what public service is here to do, then this question becomes really important, right? Because the answer to this question, we should organise everything. If the purpose and the point of public service is to help people create good outcomes in their lives, then the answer to this question, we need to organise around. This is our best understanding of how an outcome is created. This is, all you public health people are probably very familiar with this. This is the systems map of obesity, produced by the UK Government Office for Science in 2007. What happens if you shut a bunch of public health people in a room together and say, you're not allowed out until you've mapped all the causes of obesity and all the relationship between all of those causes. So 108 different factors they identified as leading to the outcome of obesity or its absence. You can't see the individual factors on this map, but you can see them summed up into things like early life experiences, food production and supply, macroeconomic drivers, education, technology, media, the nature of work, built environment. And down here in the bottom right-hand corner of this systems map, 4 factors out of 108 are healthcare and treatment options. So what this systems map beautifully illustrates is that the outcome of obesity, like any outcome, this is just one where the work's been done, is the product of all of these factors operating interdependently, right? 108 different factors all operating interdependently. And look how few of them are the things that government would tend to commission to address the outcome of obesity. So 4 factors out of 108 are healthcare and treatment options. Right? So This, how an outcome is made, is this whole system. Tiny fraction of that are the things that governments would commission, public service would commission to address. So this is maybe gastric band operations or healthy eating programs in neighbourhoods, right? 4 factors out of 108. What does this tell us about public management? It tells us that outcomes are not delivered by organisations. The outcomes we seek are emergent properties of complex systems. A delivery mindset for public service will not help us to get to outcomes. In fact, it is actively, a delivery mindset is actively harmful for creating outcomes in the world. Because, and by a delivery mindset, I mean, you must, organization this, you must deliver 7 of these by this date to this level of standardized quality, right? If that is your approach to management, it actively works against the creation of outcomes, because you'll end up holding the people here in this bit of the system accountable for the delivery of outcomes as a whole. They're not responsible for outcomes. How can people doing healthy eating programs in neighborhoods affect or control how food production and supply works, how body image is represented in the media, right? All of those factors actually contribute importantly to the creation of obesity as an outcome. They're not in control of any of those things. If you try and hold those people in control to delivering an outcome, all you're doing is hold them accountable for things they can't control. And when you do that, as we'll see in the evidence shortly, they basically just start to make up data. So you corrupt all the data required in the system for learning and improvement. So outcomes are not delivered by organizations. What happens if you try and fund or manage programs using this kind of delivery mindset? So let's take this example. What happens if you performance manage on the basis of outcomes? Fortunately, we know the answer to this question because there's been a ton of research about it. And it all says the same thing. Firstly, these outcome targets create gaming, which means that the data required to learn becomes corrupted. And secondly, the use of this kind of the reward and punishment logic of targets slows down decision making, making it more difficult to make good decisions in complex environments. So let's look at that, the evidence of the first one of those. This was a systematic review of target-based performance management undertaken by some academics in 2018. So they looked at all, if you're into your hierarchy of evidence, systematic review being the highest form of evidence there is, this is, they looked at the performance management evidence across public, private and voluntary sectors. Over 80% of studies find evidence of gaming, so that's the deliberate manipulation of data. Nearly 3/4 find evidence of people deliberately lying. Long story short, if you use targets to manage your services or manage your contracts, whatever, then you can't trust the data that you get. Simple as that. Other aspects of this, so this is all of this is operating under a management paradigm called New Public Management. It was extensively intended to create a government that works better and costs less. What do we have for 3 decades of new public management reforms? Higher costs and more complaints. So this is Christopher Hood, the most preeminent public management scholar in the world, looking back at 30 years of evidence around new public management, the kind of marketization of public service, the use of targets to manage public service. This is the overall evidence picture. Why is the current approach more expensive and less effective? Let's look at an example from Gateshead, who've been digging up some of the individual cases around what happens when you try and create standardized public service. So this is what they've done is dug up the individual public service interactions for particular cases over a 10-year period. So this is a pseudonym of a person called John. This is his public service interaction over a 10-year period, with the previous 10 years compressed on the left-hand side, and then from about a kind of a quarter of the screen over, you see the effects of a new program that they've been working with in Gateshead along human learning systems lines. And so this is just some of a zoom in to his experiences over the last 10 years. Basically, this is just his kind of health and social care bits, as you can see. So this person was suffering from alcohol problems and mental health problems together. He was a train driver. Someone jumped in front of his train. It's kind of life got more difficult after all that. So you can see that lots and lots and lots of repeated presentations, action emergency, lots and lots of interactions with the health service over an increasing period over this time. So it's all getting worse, not better, over this kind of last 10-year period. What you can see here is basically it costs over £2 million to interact with John. over that 10-year period. And the best that public service could say, so because this tracks is involved with criminal justice, it tracks involved with housing, it tracks with, and the best public services can say over that 10-year period is we kept him alive. That's it. Like everything about his life is getting worse, and we've spent £2 million making his life not very good. When you start working differently with this person, when you when public service stops saying this is what we do, how much of what we do can we do to you, when it starts asking John, really what matters to you, our job is to build a relationship with you and do whatever it is that needs to happen. When that happens, in 9 months, the Change of Futures Newcastle spent about £30,000 on this person, and his life is now significantly improving. He's now maintaining tenancies. He's now recovering from his alcohol problems. Blah, 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 blah. He's getting his life back on track. So, if places want to create real outcomes, what should they do? So what we have seen places like Gateshead and others do is embrace the complex reality of how outcomes are actually made. Because there's, as we said, I suppose we should take a moment to notice the difference between £2 million spent not helping someone and £30,000 spent actually helping someone if you ask them really what matters to them. And to do that, we need to organise continuously to learn together rather than thinking we know in advance what the right thing to do with people is. Right? So what we're doing here is freeing people from this managerialist fantasy that we've created over the last 10 years, over the last 30 years. And when I say we, business schools are largely responsible for this. So me and my colleagues really need to put our hands up and say sorry about this. But we've created this little managerialist fantasy that says, if we do program A consistently enough and reliably enough and hit these delivery metrics, we will achieve outcome B. Now, if the world was like that, that would be amazing. That would make the task of managing public service so much easier. But it's not true. The world is not like this. It is a managerialist fantasy that we have created. We are pretending that managing like this creates good outcomes, and it really, really doesn't. So what we can do is open the door to the complex reality of how the world actually works, because this is what will enable us to actually create good outcomes in the world. So this is what we've been trying to do with the human learning systems approach. That's why we call it public service for the real world. And so what human learning systems is, the human bit is about, it's a way of making public service more responsive to the bespoke needs of each person that it serves, because every person has particular unique strengths and needs. We need to be able to respond to those if we want to help create good outcomes in their lives. It creates an environment in which performance improvement is driven by continuous learning and adaptation. So for managerial purposes, organising for continuous learning and adaptation is your primary job as a manager. And it fosters in leaders a sense of responsibilities for looking after the health of systems, because as we've seen, it is healthy systems that create good outcomes. So what's the kind of key bits of that? So I'm going to focus in kind of longer presentations and go through the human, the learning and systems, but today I'm just going to focus in on this idea of learning, and learning, in particular, learning as a management strategy. So what do we mean by that? Well, learning as a management strategy starts with the public facing work. So what we've seen is organisations frame the work of public-facing workers using this kind of learning cycle. So basically saying if any public-facing workers, kind of this is your job. So let's frame this in terms of someone who, a worker who's supporting people with chronic pain. And we've got this particular example because my partner's an osteopath and she was describing her practice to me. So first job of a practitioner is to understand the life of the person that's in front of them who's experiencing chronic pain. And what that person is trying to do here is to build a shared understanding between them and the person that they're serving of their life as a system that's currently producing this undesirable outcome, chronic pain. So I might ask questions like, do you experience the pain more in the morning or the evenings when you're at work or at home? Do you experience it when you make these kind of actions, or when you eat these kind of foods, or when you're in this kind of position? Blah, blah, blah. So building up a picture of your life as a system that's currently producing the outcome of chronic pain. When we have a good enough understanding of your life as a system, we can then begin to design experiments and explorations to see whether we can get your life as a system to produce a different pattern of results, not chronic pain. So we might say, what happens if you join this walking group? What happens if we try this physiotherapy technique? What happens if we fit this enabling equipment to your house? What happens if you try this diet rather than that? We'll run those experiments and explorations together, see what works for you and what doesn't. And then on the basis of those experiments and explorations, we'll embed behavioral and structural change around your life, and we'll learn, I as a practitioner, will learn how to serve you better. So it's unlikely that that will sort everything out for you first time, so we'll go around the cycle. This is how we create bespoke public service for each and every person. We're moving public service out of this delivery mindset, I will deliver a program of activity to you, and into a kind of action research mindset. Right? My job as a public servant is to build a relationship with you, find out what matters to you, what your strengths and needs are, and together we will experiment and explore how your life might be different in ways that are important to you. That's how we get bespoke public service. That's how outcomes are actually made in the world. So if that's how the kind of public-facing work, the framing of public-facing work changes, how does that learning as a management strategy apply at different system scales? Because the idea of systems operates at multiple scales, right? So a person's life is a system, as I've been talking about, but teams are systems. Organizations are systems made of teams. Places are systems made of organizations. Countries are systems made of places. You get the idea. All of these are different system scales, right? And what we've seen, interestingly, is that no matter what the system scale, the same learning cycle is used to frame the work of team leaders, of organizational directors, of place-based commissioners. You get the idea. And what seems to happen is that people seem to connect these learning cycles at different system scales. So from all the learning cycles that are happening on the ground, so say you've got a worker with 10 clients, so each one of those clients represents a learning cycle, and you've got a team of 10 workers. So you've got 100 of these learning cycles within this team happening at any given time. The patterns of all of this kind of continuous experimentation and exploration, what do they show? They will throw challenges up to business as usual for how that team is organized, right? So they might ask questions about what are the maximum caseloads for workers that enable them to do their job well? What's the shared reflective practice spaces we needed to create as a team to understand what's happening here? What are the patterns of need that gets created? And therefore, what are the staff capabilities we need to recruit and train for, right? So all of these things from the experimentation, from the work, become the meat for the team leaders learning cycle, right? They need to understand all of these challenges to business as usual, have curiosity about them and oh, that's not how we do things around here, but instead say, okay, what do we need to experiment with? What experiments do we need to design for how we organize our team in order to respond to the challenges coming up from the work? And that is the essence of the kind of team leader's job, to create that team environment as a continuous learning and experimentation. And so what we see if organizations and places adopting this way of working is this connected stack of learning cycles from the ground upwards that starts with the work and essentially goes right the way up through to the minute. And just kind of a couple of points to really emphasize around this. Sometimes when I do these presentations, people hear that kind of measurement and data isn't important anymore. And so I really want to emphasize that is not what I'm saying. But actually, the use of measurement and data around this stuff is really, really crucial, because you need to use data to understand the system at whatever scale it's talking about. So practitioners need to use data to understand the lives of the people that they're important. And so to understand here, data means stories as well as kind of numbers. Data means anything that is required to get a grip of the particular system. And you need to collect data to understand what's happening with your experiments and explorations. Because in order to do this stuff rigorously, it's no good kind of trying stuff and saying later that that was an experiment. Like, experiments and explorations have methods. They collect data, they do sense making around it. This is what's required in order to make these kind of approaches work. So it requires a more rigorous approach to data and measurement, but it's allowing kind of data and measurement to do its job properly. Some other questions. So we're doing a bunch of work with Healthcare Improvement Scotland and also the Improvement Cymru as the equivalent body in Wales. And one of the questions that comes up in those kind of health and social care improvement contexts is, isn't it just good quality improvement or good quality management systems? And in some respects, the answer to that is yes, because you'll see the kind of the similarities between kind of learning cycles and PDSA and blah, 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 a bunch of things that people with quality improvement skills and experience will do. But we think that human learning systems provide a more effective context to enable the best of kind of QI and quality management to do its job properly. So I was watching a presentation by Professor Stephen Singleton, a kind of QI expert, to the North East and North Cumbria Integrated Care Board a few months back. And so he was going through taking people through the practice of kind of quality improvement, like particularly QI at a kind of service level. And he finished his presentation with an exhortation to managers to focus more on learning and less on performance management. I thought, yeah, that's exactly right. But also, those kind of exhortations to managers don't work. What we need to do is to systematically change the purpose of management to focus on learning and not performance management. Because you can't just exhort managers to do that when all the structural drivers in the system are saying you have to do these performance management things. So the human learning systems is a way to change the management environment so that every manager's job, the purpose of that changes. So in terms of a kind of potential relationship between QI and human learning systems, it's the kind of learning techniques and methods that QI enables people to practice. They are a method for the kind of person-centered public management for human learning systems, and that in turn creates an enabling environment to enable the kind of the best of QI to do its job. So just in case you're kind of interested and this has kind of piqued your curiosity and you're wondering, oh, this all sounds a bit radical change. Is anyone actually doing this? Everything that I have told you today has been learnt from the organisations that are doing this in practice around the world. So all the theory we've ever built around this comes from the practice of people who are actually doing it. So at the national or transnational scale, you've got Finland and Scotland and Sweden and Wales and bits of the kind of United Nations Development Programme kind of thinking about working in this way. So we've got our kind of latest case study. This is from the Swedish International Development Agency, who created a new kind of funding programme built around that kind of learning cycle that I've just been telling you about. And on a local scale, there's too many now to talk about in kind of UK contexts. The latest one of these is kind of it's not even on here. North Lanarkshire's Health and Social Care Partnership has decided to use kind of the human learning systems approach at a strategic level to think about how to tie together all of the different work that as a health and social care partnership is doing. So if you want to try this for yourselves, the Healthcare Improvement Scotland commissioned, kind of worked in partnership with us to produce this, what we ended up calling Human Learning Systems, a practical guide for the curious. So this is almost like a kind of step-by-step way to think about how to create learning systems in your context using this kind of framing of learning cycles. That's all free to download. Also, if you do kind of download and use this, we'd love to hear from you about it, because that was our first attempt to create a kind of how-to guide for any of this. So understanding your experiences of using it will help us improve it. And you can ask any of my lovely colleagues at the Centre for Public Impact will help on this links in the presentation when that's shared. There's also a ton more information, including all of the case studies that of all the places that are doing this in practice are on the humanlearning.systems website. And there's just basically that's our kind of knowledge repository for all of this. Everything we've ever learned about this stuff is all there. And so that's kind of it from me as a provocation. I was asked to think about, are there any questions that it might be useful for you to think about in your breakout groups? So these are some these are just some things that I thought might be interesting to discuss, but you will undoubtedly have your own ideas about what conversation is useful for you. So how well does your system scale create the conditions for collaborative learning? And like, what data do you have to understand how well people are able to collaboratively learn together? So if you were going to undertake some experiments to enable the actors in your system to collaboratively learn together better, what roles might be helpful? How might you convene that? Particularly, how might you commission and contract for learning? Because that we have found that is about the most significant thing. How the money behaves really affects how people are able to learn or not. And from some of the other experiences we've seen from other places, how might you turn contract monitoring into shared learning and sense-making environments? So just some things that you might want to consider in your groups. That's me. Hope that was useful, interesting in some kind of way.
Toby, thank you so much. Gosh, I've taken copious notes and was really fascinated in what you were saying there, and it really speaks to, I think, to every one of us in this room who work in different parts of the health and care system and actually deliver care in some form or another, or commission or manage it, or a combination of all of those, and are struggling every day to think of a different way to do it, because what we're doing is very difficult. So we've got some time for questions. I've got loads of questions, but let me go to the room and ask who's got their hands up. If I could ask one of the facilitators to flag that. Questions in the room?
I don't think we've got any hands up yet or anything in the chat, Elizabeth, but if you maybe could start with your question, and that might open.
Okay, so I've just seen something pop up in the chat
oh yeah,
from Salima. Hi there. Toby, I don't know if you can see that. I'm interested in how we change our commissioners' mindsets, and I think we've got a commissioner speaking shortly, haven't we? So we've anticipated that one, but Toby, how would you respond to that?
So exactly, one of the the way that we kind of work around this, we don't really try and change anyone's minds, because it's hard to change people's minds about this. But the question I would ask commissioners is, like, are you happy with how it's working now? And so here's a bunch of the evidence about how it's working now. Does any of that resonate with you? Do you do you feel like how it's going at the moment is working for you? And if you have any sense that this could be better, or do you know what, I've got a sneaking suspicion that this isn't working in some way, then let's talk about ways to explore to do this differently. And here's some examples, and here's some examples. And here, what we're trying to develop in people at the moment is they have a choice. We have a choice about how we do public management. Right? For too long, we've thought there's just one way to do management. Right? You set specifications and you turn those into targets, and then you manage performance against those targets. Right? That isn't just what management is. We have a choice about how we do management. And for those that are curious about what a different choice might look like, we've now got a kind of ton of stuff that would help people explore that, I suppose. So that's the kind of long answer. The short answer is, like, listen to Gary in a minute and see whether any of that resonates or makes sense.
Thank you. Thanks, Toby. And I don't see any other points in the chat box, but
there's someone with their hand up.
Oh, is there? All right, beg your pardon.
Thanks, Toby. That was fascinating. I'm Sharon, Principal Consultant at NEX, and I was a commissioner for 9 years. So I'm curious to listen to the commissioner speaking shortly. But my question sort of on the basis of what you've shared so far was, is Scottish government, for example, if they've commissioned the guide, and I'm interested in, looking through that as well, because I'm doing some work in Edinburgh at the moment. So is Scottish government actually, or and his interested in sort of commissioning, the kind of implementation of the learning from the work you have done with them to date across the patch? And sort of one question is that, and second is sort of, at national level, are there plans to sort of, implement this at scale? Because something like this needs to be implemented and rolled out at sort of national level or system level. But of course, we know ICBs currently are, facing their cuts and pressures. So all systems are struggling. And in the midst of that chaos, how does one start introducing this approach? Because the focus definitely is currently on outcomes.
So yeah, thank you. I heard quite a few different questions in there. I will do my best to kind of respond to those in turn as I can remember them. But if I miss something, please do kind of remind me. So,
is it being implemented at a kind of national scale in Scotland? The answer would be kind of in patches. So particularly through kind of Healthcare Improvement Scotland's change work at both kind of local and national scale. So they are working with places like North Lanarkshire to help them explore this kind of human learning systems approach, and then kind of advocating as they're acting as a change agent for this kind of stuff at the national scale in the various conversations that they're involved with. So I wouldn't by any way stretch claim that this was kind of Scottish government policy, but there are a bunch of kind of contexts in which this is being tried at kind of local and national level in Scotland. There was a question about how people can start this in kind of current context when current contexts are so stretched and when everyone is so frazzled. I suppose, and I absolutely recognize that, and it is like
anyone trying to make kind of significant change in health and social care settings right now is in some respects like swimming against a tide that is so kind of vicious that it's kind of barely imaginable. But I suppose all I can offer is some of the examples of places that are doing and trying this stuff. So we've just been working with one council who have been doing this kind of change process under the most difficult conditions imaginable. So on the day that we started working with them, the council as a whole went into administration. They're kind of section 114 stuff, and so for the entire duration that we were working with them, Gary's comments in the chat are worth reading. They were staff were kind of having to put every kind of possible decision up through like the government overseers, and everyone was worrying about whether they were going to have jobs next week and all that kind of stuff. And they were able to make kind of significant changes in how they did their kind of strategic management and leadership, even under those kind of conditions. So in some respects, I have no idea how they did that amongst that kind of carnage, but they did. And the confidence I gained from this stuff that it is possible all comes from the kind of wastefulness that is baked into how we do things at the moment. So as soon as people quickly after people start to do things differently, can start to eliminate some of the waste that we create by not helping people. Because at the moment we create so much waste by not so many people's jobs are focused on doing the things that we have thought that other people think are appropriate for that place.
Toby, you've got another question here, or another observation actually, a handout from Ruth Robinson, but a question, a point in the chat box too. So let's ask you to pick up Katie's point first, and then we'll come to you, Ruth. So Katie saying, really fascinating presentation around equity, being person-centered.
Yeah, exactly. So I mean, personally, I think that this comes down to the what we mean by equity. So if you mean by equity offering the same thing to everyone, then obviously this isn't an approach that meets that definition of equity. But offering the same thing to everyone isn't really very helpful. So it is. I think where the equity comes into this is everyone
should have access to a bespoke approach. Right? So everyone should get the personalised care that they need. And the point of that is it is not possible to specify from up here what the care that someone should have is, because it is impossible to know from up here what the care that someone has. Like, it is literally impossible to know at a policy level what the care that I should get that's different from the care that you should get that they should get. Right? So what at a policy level in terms of equity we can guarantee is that everyone gets the bespoke support that they need. What we've tended to default to, because it's easier for kind of a managerialist perspective to get their head around, is to try and define standards and say everyone gets those. But what that means is that almost no one gets what they need. So in some respects, I think it's our kind of a misframing of equity to think about that in terms of defined standards of stuff. Now, that is just a personal perspective on that. So other opinions are available.
Okay, it's interesting. I was struck by that really powerful story about John and the staggering use of resources and terrible experience for John, and how much the use of resources dropped, and he had a much better outcome and experience, which presumably would have released resources for other people. So different ways of looking at it, aren't there? Ruth, let's come to you. You have your hand up. Thanks.
Hi, thank you. Yeah, I'm Ruth. I'm a mental health commissioner at Cheshire West Council, and we are very much as commissioners trying to do this stuff, and have been doing it for some time in terms of trying to commission based on outcomes for people, absolutely base our work on what matters for people, what's the most significant change that people want to see in their lives, and it could be minimal, and it could be, it could be a lot bigger. I think some of the challenge that we have is around that traditional approach that, in fact, our colleagues have within social care and especially within healthcare, is very much a fixed model of ways of doing things. So although we are trying to develop, community-led support and absolutely working with third sector and just assets and people in the community to keep people well, closer to home, all that good stuff, we find, it's a bit of a, it's not a battle, but it's a challenge to get our social worker colleagues to think differently and to be to feel that they've got permission to do things differently within the constraints of legislation and the ways that they do things, and commission in the way of hours of support for people, not outcomes. And so it's a big mind shift for, I think, colleagues. I think for ourselves, commissioning our kind of, we get it, and are absolutely working with providers to try and do it. I think it's it's working with colleagues in those more fixed systems that is a challenge.
Thank you. Toby, do you want to respond to that?
Yeah, indeed. Again, the relationship that commissioners can have with folks to change how care systems work is really interesting. And again, Gary will speak to a bunch of practice around that. So commissioner, one of the things I would say is, so long as the relationship between commissioners and providers is commissioners telling providers what should happen, and whether those are service specifications and whether service specifications exist in terms of outcomes or outputs, it's still the same. We're telling you what has to happen in a relationship. The interesting thing we've seen happen in commissioners is where commissioners recognise themselves as part of the care system and say, our role here is to help create the care system as a system of continuous learning and adaptation. So what can we do as commissioners to enable all of these care relationships to be focused on continuous learning and experimentation? And again, Gary can talk about the practice of that much more eloquently than I.
And there's a point in the chat that sort of might be a bit linked to that, actually, and a really interesting angle from Lisa Guesti, who's a vast experience in OD. And I don't know if you can see it, she's an OD practitioner working in complex adaptive systems. How can I bring an OD lens to this? And when I reflect on the work I used to do in emergency and urgent care with people with complex needs that we would see many times there, we trigger case conferences with lots of system partners. I don't think we ever had OD and leadership and learning partners there.
Yeah, exactly. And there's so as I understand the kind of role of OD in those kind of contexts, exactly like helping leaders to change their role in all of this, so that the role of kind of managers and leaders becomes primarily how do we organize for learning and adaptation. And that is the thing that then leaders and managers are held accountable and blah for and all that kind of stuff. So one of the things I'm fascinated about the kind of role of OD in this kind of stuff is how do we change how governance and accountability works in organizations and places? Because in the end, unless that stuff changes, all of this stuff is always kind of swimming against the tide. So that's how we know that this stuff is really embedded in the context, because the governance conversations change. And again, Gary can speak to some of that kind of stuff. And interestingly, Keisha's presentation later, because someone is bound to say in this conversation, what about the role of regulators? And that's a kind of great question. And one of the things that my colleague Keisha will be able to share about is what happens when we start asking the question of regulators, what's your role in generating effective learning systems? And that's some of the work the work that Keisha can share. It will be sharing just in a little while.
Thank you. Let me come to Helen. Helen, you've had your hand up patiently for a bit. Thank you.
No problem. Good morning. I found that really, really interesting. I think one aspect that you said is that we tend to, at the present time, to push John through the system. And I've been listening to the conversation. I think it's really interesting that we have to change our mindset, and that's of our colleagues. So effectively, if we move away from a system where something is done to John in a sort of, I guess, simple transactional solutions at each step, what's John's experience when we have a system that's done with them, as it were? So, you know, all of this is great. How do we take John with us? And what are the challenges there?
Yeah, absolutely. I mean, and in some respects, understanding the public service journeys of all of the Johns of the world is a kind of really powerful way of thinking about improvement and all this. So if you're interested in delving into some of that kind of stuff further, I can really recommend a bunch of the stuff that Mark Smith from Gateshead and Changing Futures Northumbria has been writing about the liberated method. I can post a link to that in the chat. So what? Because that the work around John is their work, and they've been doing a bunch of really kind of deep dive thing on what then when the role of workers is reframed to do exactly as you were describing there, build a relationship with people and respond to whatever their strengths and needs are, learn together with them. One of the really interesting things that learning from their experience is that what they detected was a universal increase in innovation that comes from being able to build compassionate relationships with people. So once we liberate workers, in their language, to build compassionate relationships with people, every one of those cases that they looked at now started to generate innovation. So there's something really powerful about using compassion as the kind of basis for innovation, and that it enables the people being served to innovate in their own lives as much as the people serving it, because it's not the role of the worker changes from I'm just repeating the words that you were saying.
I was going to touch actually on something you said about your partner being a chiropractor and trying different things. I think one of the difficulties in the system that we have is people's expectations of a simple fix. And what's got me in that chiropractor example was trying different things. So part of that is getting the mindset of the individual to recognise that they're on a journey that isn't going to have a perfect solution in a very simple way. And people have complex needs.
Absolutely. And so just in case my partner watches this back, I should say that she's an osteopath, not a chiropractor. Yeah, exactly.
Oh, apologies.
But so an example that she shared with me that I think is like kind of really illustrative of this. So she was saying that she had an anonymous client who was experiencing chronic pain, and part of when understanding that person's life as a system that was producing chronic pain, she found that that person's partner was catastrophizing his pain. So every time his back twinged, their partner's like, "Oh, are you okay?" And that was locking him in his experience of chronic pain. So part of her treatment, the experimentation that they did together to alleviate and help manage his pain, was that they asked the question, how can we change your partner's relationship to your chronic pain? So they tried an experiment where so he was having breathing exercises whenever he had an episode of kind of really flare up chronic pain. So he said, let's try giving your partner a role in this. Let's ask her to count the number of breaths that you're doing. And that, like, changing the partner's role in relation to the person's chronic pain was transformative in that person's experience of chronic pain. And it is that kind of approach that this kind of thing makes possible.
Well, thank you. That's actually a really good example to use. I'm going to move us on, I think, and hear from Gary, who's going to share some work that's been going on in Plymouth. He's been working with Toby and CPI on that, and I think that might answer some people's questions. And there's also a panel discussion later with Keisha, our third speaker. So thank you all for your chat and your questions and that rich discussion. Let me introduce Gary then, who has a wonderful bio, and I'll try and do that justice. So Gary works in the Office of the Director of Public Health for the City of Plymouth, and has had many different roles in clinical, developmental, managerial, research, and strategic aspects of work. And he's contributed to policy development nationally and internationally. In working with the NHS and local authorities and the charitable sector, he's really embraced the need to do things differently. And he's currently a member of the Plymouth Alliance leadership team and very active with the Human Learning Systems Collaborative. He's got a strong academic interest and is an honorary university fellow at the Peninsula School of Medicine and Dentistry at Plymouth University. I was a 2019 Fellow of Practice at Oxford University Government Outcomes Laboratory. And he's now going to talk about his long-standing interest in improving the commissioning and delivery of services for people with complex needs and multiple vulnerabilities. So Gary, over to you.
Thank you. So someone else is going to control my slides, so if they can move the slide on. Yeah. So I manage a thing called the Health Determinants Research Collaboration, which is a partnership between the university and the council, and it's kind of got two roles, which is the first is to increase the appetite, capacity and capability of the council and the wider city in accessing, using and developing, doing research. And the second part is to spread human learning systems further across the city. So we have loads and loads of human learning systems projects. Here's a list of some of them. And I'm kind of a learning partner in all of these. I'm going to talk to you today about the Alliance for Complex Needs because it was the first one we did. So this started when I was the Associate Director of Public Health, and I was responsible for overseeing all the commissioning. And I had a bit of an epiphany. So obviously I've always had a foot in academia, and I was aware of the research, some of which Toby has cited, about the failed utility of new public management. And I just had a realization that at the time the buzzword was be an outcome-based commissioner. And I suddenly realized I could either be an outcome-based commissioner or I could be an evidence-based commissioner, but I couldn't be both. And this was kind of the genesis of all this stuff. So next slide, please. So just a bit about an alliance contract. An alliance contract is a legal partnership agreement. I'm not going to spend a lot of time on this because there's a lot of public information. There's a woman called Linda Hutchinson, and you can find her on the internet, and she's really kind of an expert. But essentially, it's a bunch of services and the council pooling some of their sovereignty in order to enter an equal partnership. Next slide. So if you click through, you'll come to, there's some things that pop out with that. And another one, that's it, thanks. On the left is a traditional kind of contract. Now, if you go back up to the drawing, this previous slide. There you go. So on the left is a traditional contract system where you have one commissioner who's probably commissioning lots of things. Often without any relationship to other things that relate to the thing they're commissioning. So on the right, what happens with an alliance contract is when the contract is let, a number of, so in our case, there are 25 services in the alliance. They elected 7 CEOs from their number to sign the contract. They are then joined by 3 commissioners to form the alliance leadership team. So it's 10 people, 1 person, 1 vote, unanimous decision making. All of the money that the council and the NHS previously spent in the area of complex needs is devolved in its entirety to the alliance without any targets. And the alliance is free to spend that money as they choose in order to deliver the things we collectively agree in the leadership team are what's needed. And then once a quarter, we meet what's called the owning commissioner. In our case, that's the director of commissioning, integrated commissioning. So all Plymouth's money is integrated with the NHS. So it's a single heap of money and an integrated commissioning team. And the role of that commissioner is to problem solve, not to hold the alliance, not to performance manage the alliance. Next slide. So alliance contracts, they look different. I think our contract is on the Human Learning Systems website. It's a principle and values-based contract, and these are some of the alliance principles. Everybody signs up to these, and they're about transparency and partnership and making decisions on the basis of what's best for people, not what's best for services. And no fault, no blame culture where we value learning. Yeah, so the next slide, please. And again, we'll click through that. Thank you. So with this kind of began when I was, as I say, when I was the associate director, so with a failed lottery bid. And as part of that, we did a huge amount of what we would call co-production. So various methods to kind of glean stuff, and we talked to everybody. So we talked to people that use the system, we talked to their relatives, we talked to public facing workers, we talked to commissioners, we talked to managers, we talked to everybody. And what we found is the system wasn't working for anybody. Nobody was happy with the way it was working. And a really key thing for us, which is a recurrent theme in all systems, is appreciative inquiry as a learning method. Next slide. Okay, so this is where a lot of our learning kind of chimes with what the research says. What we found is quantitative proxy targets, without exception, always create gaming, and they never capture value. They never actually capture what matters to the person, and often not what matters to the staff either. And that's because the targets, as Toby described, they have little or no relationship to people's lived experience. And the way we, the commissioners, performance manage those was simplistic, misleading, and devices. In effect, commissioning practice was setting the problem. It was the kind of root of the problem. And we realized we had to change that first. The other thing is the fetishization of competition was driving out cooperation. If you work in health and social care, you need extensive cooperation, and there was no incentives in the system to produce that. If Service A thinks they've got a unique selling point, and a spoiler alert, they don't, but a lot of them think they do. And Service B doesn't. Why would they share that with Service B when they're going to compete in 3 years for an ever diminishing pot of money? There's no incentive to do that. So you need to address that, recognizing that in complex service areas, so people with this is about people with the making every adult matter definition of complexity. In those areas, services can't deliver outcomes. At best, they can deliver an output. We also found, looking in all the areas of kind of mental health, offending, substance misuse, and homelessness, a lot of the practice is routinized. So even if you get in the service, you'll get a routinized package of care. Particularly in NHS type service, you get 6 of this or 4 of that, and nothing is bespoke. And so you get large numbers of people not attending appointments or basically not being able to use the offers. So what we would realize we need to do is incentivize cooperation, develop ways of including everybody, and work harder to understand value for people rather than targets. Next slide, please. So very broadly, we were trying to move from this thing on the left, which is how most of us were doing public service, to this thing on the right, which is looks like motherhood and apple pie, but is actually what we're trying to do. Next slide. And again, so the process of how do you do this? So this is how we did this. Now, this took us, we began this process formally in 2014. We let the contract in 2019. So it was a 5-year process. It was a real kind of privilege to have it because we were able to do all of our learning. And so all that list of other systems I've given you, we're much slicker and faster and than we were then. So this is where we kind of made all the mistakes. But this was our starting question. It's a fairly typical starting question for any, a lot of you will be familiar with this. So can we have the next slide, please? So the approach. So this is about what a learning strategy looks like. So we had, as I say, 25 services. So we had sometimes 70 or 80 staff at events. And you can't just point at a service or a person in a service and tell them to be different. You have to have a method to get them from where they are to where they want to be. So you have to build empathy with everyone across the system. And the way you do that is by involving everybody in the exploration of the system. So you all learn together, you all witness things together. But you need to provide workshops where you can equip staff with various theories, tools, and time to plan and work together. And then you need to do extensive field work as a collective. So 2 people going out to gather some appreciative inquiries, maybe someone else is running an open space event in a local community, those kind of things. What we found, and we continuously find, is when you do this work, you will find workers in any system who become absolutely passionate and gripped by this thing. And it's really worth putting more time into those people, because they will become the future practitioners. They won't need us anymore. They'll be able to do this themselves. And so you put extra effort into those people. So you give them a bit of coaching and mentoring, give them time to reflect and learn, because they're going to become the system leaders when we've finished our facilitation work. And this is what we're trying to do: build empathy, insight, and understanding for everybody in the system. And when I say everybody, I mean everybody, from the service director, the number 1 commissioner, right down to the person using the service. But also, so one of the things we often do as a test is, I would say to a chief exec, if you're cleaner, the person who spends more time in the waiting room than any other member of staff has a brilliant idea, how would you know? And very often the chief exec doesn't even know who the cleaner is. Next slide. So kind of in steps, the first phase is exploration, system exploration. And for us as commissioners, when we started to do this, we don't need to do this anymore because we've been much nicer recently, is share why we're here. And for commissioners, a lot of that is truth and reconciliation. you need to sit there when the service tells you you did terrible things to them, when you cut their contract, or you were really kind of aggressively performance managing them, or whatever. And similarly, we needed a space where services could tell us, well, that thing we wrote in the bid, we had never had any intention of delivering. We just thought we needed to put it in or we wouldn't get the contract, all those kind of stuff. So what you're trying to do is move from this set of relationships, which is essentially based on dishonesty. So targets, routinely, when I was managing contracts, people would tell me things I knew weren't true, but they changed the indicator from red to green. And so, everyone from the service right up to the regional performance managers are happy with that, even though most of us know it's entirely fantasy. So what we're trying to do is have a set of honest relationships where people can say, I'm struggling, this is not working, we need to do something different. And then collectively, what you're trying to do is identify what value looks like in a system, because you find the system doesn't work for anyone, doesn't work for staff. And one of the ways you can do that is, which we do a lot, is this thing about creating empathy maps. So you gather stories from people about their lived experience of the system. You sit in a circle and you read those stories aloud to build this understanding of what life is like in the system. And you might go and agree bits of focused work you want to do about particular things that have all emerged from bottom up. So it's not about imposing our lens, it's about deriving all of our learning from the bottom up. Next slide, please. So it's a kind of an iterative process. So you might have a round of field work. So the first round of field work, I think we did about 200 appreciative inquiries with people in the 4 different silos. And then you learn stuff about themes, and then you form those into new questions, and you go back and you chase those themes. So everything you're chasing is generated from the bottom up. But like Toby says, you also use data and you look at what your budget is and you look at policy very often. So a really good example of this is the work we did around smoking cessation, is you find services have drifted away from the original purpose. And a lot of that's to do with targets, creaming, parking, all that stuff that you need to do if you're going to get a kick in if you don't achieve your targets. With smoking cessation, the foreword of the policy basically says this policy is to stop poor smokers dying younger than everybody else. And then you look at who is going to smoking cessation, no poor people. And so very often it's very useful to go back to the original policy. And it's the same with governance. Very often people who are blocking stuff will say, we're not allowed to do that. And what you'll do, if you go back to the original governance, there's no reason why they can't do that. What happens in organization is what I would call cultural accretions. So these kind of myths about what you can and can't do. And very often you can resolve those simply by going back to the written word. Next slide. And then we kind of collectively agree what we want to achieve. This is a big change. So the commissioner does not say this is what we want to achieve. We need to agree. And the way there's no magic to this. It's relentless iterative discussion. So it's one person, one voice, everybody equally valued. And we spent weeks talking, discussing, arguing. But because you've done all this work in the exploration phase to build relationships between people, relationships of empathy and trust, if, let's say, Toby disagrees with me, I know it's not because he's a bad person, because I've spent several days with him, learning about him and him learning about me and us learning stuff together. I know I have to engage honestly with his argument. I can't just write him off as a bad actor. And then you can refer back to your fieldwork to resolve disputes. You can identify cultural differences. Often, an NHS culture is different to a VCSE culture, and the NHS is used to thinking in that scenario their culture is superior. A lot of this is about unpacking that and seeing it's just culturally different. It's neither better nor worse. It's different. And then if you can't resolve it, then run 2 experiments or prototypes to resolve the dispute. So again, any resolution is based in evidence. And it's based in the practice of experimentation. Next slide. Yep, so experimentation, it's more of a kind of constant process. So good ideas are not an artifact of hierarchy. Rich white men think they're right about everything. Most of us know that's not true. But similarly, very often, very senior people think they have to have the answer, and they rarely do because they're very remote from the problem. So what you're trying to do is create permission for everybody to try things. And once you start that process, it really quickly becomes infectious, and everyone, most public-facing staff have got a bright idea that they've never been able to land, and they'd love the opportunity to try. So they can be really tiny. 2 workers, say, you know, one from drugs and one from mental health, say, why don't we run a joint clinic in the direct access hostel on a Wednesday, and make it permissible for them to do that with minimal governance. Don't get them to do a 20-page business case, just half a page of A4. Tell us what you want to do. Is it legal and is it safe? And if it is, then you have permission, but you have to gather the learning. And we don't mind if you fail because it generates learning. And so this kind of dichotomy between a failed experiment and a successful experiment is really meaningless. It's all about gathering the learning and then applying that. And you try to embed what's worked well, but be prepared to change if learning or circumstances change. This is why the phrase, what does good look like, is ludicrous, because good is constantly changing, because the system is constantly changing. And the best, we all have this fresh in our minds, because we were all doing things the day before COVID lockdown that we thought were brilliant. And then COVID happens and they became life-threateningly dangerous. So that's a really gross example about the kind of small things in systems that change, that make good change. And so really what this is about, human learning systems, is about unleashing the talent of our really qualified staff to be thoughtful about their work, not to be constrained by routinized approaches. The people that cost us a fortune in systems cannot engage with transactional, packaged, routinized services. They need highly bespoke approaches. And our workers know this, and a lot of this is about liberating the workers to do the right thing. My bet is most of the people in this kind of virtual room today will have breached at some time will have breached the rules to do the right thing. If you have to breach the rules to do the right thing, the rules are wrong, and you need a new set of rules. Yeah, next slide, please. Yeah, it's just a reminder that change is a cultural process, not a structural process. The NHS and councils, when they have a problem, they tend to see the answer as a restructure, but actually it's always about culture, how you change culture. So we only introduce structures that provide us learning loops. So typically a practice-based forum and a high-level forum, which are connected by learning. So the learning that's generated from the difficult cases is fed up to the optimization group, so the optimization group can change the system. We work really hard to build empathy between everybody, and we try not to be negative about people. So very often people are highly affiliated to their service. Traditionally, we would have said they're resistant to change, but now we say they're highly affiliated. And our role as system leaders is to build bigger affiliations, newer affiliations to a system. And the way you do that is by involving them in the work. So you're not imposing anything. It's kind of organically growing into. Next slide, please. Just some stuff, like Toby said, we're not anti-data, but we treat them as learning aids. So the thing that's an issue in key indicators is the P. The P in KPI is the problem. So targets are gained when there is a positive or negative contingent on the outcome. So we treat them as indicators. They tell us stuff about the system. And when they change colour, we try to understand why they change colour. We don't try to make them change colour. All of our learning says if we do bespoke and we do the right thing, all the things we care about get better anyway. It's a kind of weird thing where you need to keep them in your peripheral vision, but not stare too hard at them. We are constantly trying to understand how best to, in the jargon, measure stuff, or we would say understand stuff. So how do we understand success in an asset-based way? And this is why we talk about value and relentlessly focus on what actually matters to people. And when I say people, I mean staff too. New public management functions in hierarchies, which deny staff the three things research tells us they need for a happy and fulfilled work life, and they are mastery, autonomy, and purpose. Mastery is to be good at a thing, autonomy is to have some control over how you work, and purpose is the sense that you're making a difference. And we routinely find staff don't have that. And one of the kind of accidental things that happens when we do human learning systems is long-term sick rates tend to drop off a cliff. And we're never trying to make that happen. But the most stark example was a service that had 22 on long-term sick when we started and 4 when we finished. I think that's the last slide, but I'm just going to make a couple of points. Quite a lot of the problems we have in systems are a problem of conceptualization. So as an example, I would say the current crisis in everybody's emergency department, where people are saying there are loads of people with mental illness, with self-harm or suicide, and they shouldn't be here. And so we need to build a place of safety somewhere else so they don't come here. And so we build a place of safety and we staff a place of safety, and they still come to ED. So another way of conceptualizing that is we have a policy of parity of esteem for mental health people, where they should be treated equally to physical health. And there's this amazing thing in the UK that everybody knows: if you have a problem, an emergency, there's this place you go to, and it's called the emergency department. The problem is when you get there, if you've got a mental illness problem, they're completely unsuited to serve you. We should change the ED. We should have mental health staff on site in the ED with proper parity of esteem, because as the rule of Tesco's car park says, you know, when they build a superstore and they build a car park and they build a path from the car park to the store, if the public walk across the grass, they move the path because they know they can't move the public. So, and the last thing I want to say is when you're commissioning in a human learning system, so speaking about the Alliance contract was let in 2019. There have been 41 contract variations since 2019. So the way that works is something in the world changes, which makes something in the contract redundant. So we vary the contract to reflect the new reality of the system. So that's how an iterative commissioning relationship in human learning systems works. And I'll stop now.
Gary, thanks so much. You've given us an awful lot to think about, and really brought to life some of how this is working in Plymouth, I think. And the description of the Alliance was very visual. We could understand that. And I think I really love that link through local people, the way that the leadership and the people within the Alliance are working, and the way that also people themselves are finding it more rewarding to work in that system, as well as greater outcomes for local people. I'm not going to pause for questions to Gary now, because what we're going to do is ask you to hold your questions for both Gary and Keisha, our second case study speaker, and put them to those individuals and Toby in the panel discussion coming up shortly. So without more ado, I'm going to welcome our next speaker. We're very thrilled to have with us Keisha Swaby, who is in fact from Greater Manchester. So she's one of our local experts on this. Keisha, like Gary and Toby, has an amazing bio. She joined the CPI in 2022, focused on a work to strengthen and reimagine relationships between governments and communities. She's got a master's in social innovation and a huge amount of experience in working across all sectors. She's really done some pioneering work and won awards for her work, co-designing mental health services with and for Black communities, and she's done a lot of work in transforming educational spaces leading a national project to empower young people and the public to set a new direction for education and learning in England. We know that Keisha is really passionate about harnessing the power of research, design and innovation to co-create equitable and alternative futures for local people. She's a fellow of the Royal Society of Arts and a member of the Design Research Society and the Systemic Design Association. It's an amazing bio, Keisha, and we're really looking forward to hearing from you. Over to you.
Thank you, Elizabeth. Good morning, everyone. If we just skip to the next slide. So good morning, everyone, and a huge thank you to the organising team for inviting me to be here with you all today. You'll have to bear with me a little bit. You can probably hear I sound a bit bunged up because I'm just recovering from a cold. But just to correct you, I'm not from Manchester, although I wish I was actually, because I do love Manchester. But I've done a lot of amazing work with Greater Manchester Combined Authority, and that's the work that I'm going to talk to you about today. So as Elizabeth said in the intro, I've been at CPI now for just over a year. And I really focus on our work to strengthen and reimagine relationships between government and community. So I've had the pleasure of working across a couple of different projects in the Northwest, actually. So I've been involved in a piece of work with Lancashire County Council, so working with them as a learning partner, supporting them to build the infrastructure and the culture of learning within the public health team. And then I've also done some work partnering with the Greater Manchester Combined Authority to bring together regulators, inspectors, and local authority providers to build more collaborative relationships around regulation. And that's the piece of work that I'm going to talk to you about today. So I'll just share a little bit about the journey and some of the learning that we've done in the work so far. So next slide, please. So the start of this learning journey, just the one before. So the start of this learning journey, it actually predates my time at CPI. So we started this work back in 2020 after hearing again and again from both public sector leaders at a national and local level and from leaders in regulatory and inspection bodies across sectors that the way that leaders work together around regulation wasn't really enabling public service improvement. And we also heard that in some ways, regulation was proving to be a bit of a negative cultural driver and a brake on innovation, rather than the tool for public service improvement that it could be useful in terms of how do we improve and how do we learn differently and better. So to begin the learning about the challenges and the opportunities here, we at CPI, in partnership with Easier Inc., we chaired a national community of practice, which comprised of over 40 regulators, inspectors, auditors, and public service delivery organisations. And what we wanted to do is that we wanted to bring together those on both sides of the regulatory relationship, so those who ensure that it's being upheld and those whose work is guided by it, to explore how we could work in a different way. And so I think what the community of practice did was that it gave us a real insight into the barriers in the way to collaborative regulatory practice. I think, firstly, it raised the really knotty problems around accountability and how we together, across the regulatory relationship, foster a culture of responsibility and accountability and work together to generate that. I'd say, secondly, it also raised some really interesting questions of what drives culture in local authorities and other public services, and how to incentivise positive risk-taking, both from a local authority leader perspective and from the seat of regulators and inspectors. And I think really importantly, whose actions, because they are in the system and not outside of it, shape the system. And then thirdly, it also raised how current regulatory relationships and practice can create myths that perpetuate within organisations, and the impact that subsequently has on innovation and adaptability. So we'd hear things like, oh, we can't do that because Ofsted won't let us do that, or we can't do this because of CQC. And some of that actually turned out to be myths. But what we also heard really strongly was that some of the barriers in the system really highlighted some opportunities for transformation. And I just want to reiterate, and I know I've said it a little bit before, it's important to note that the myths are perpetuated by both sides of the regulatory relationship. So it's interesting for us to think about how we might create a collaborative learning environment. And I think our initial work with the community of practice proved to us that was really something there worth exploring. So since the community of practice, as part of our work, as part of the Changing Futures work, we've been running an action inquiry with partners in Greater Manchester Combined Authority, Rochdale Borough Council, Oldham Council, CQC and Ofsted to identify entry points for change that we could implement in Rochdale and Oldham local authorities. But specifically, we were looking at services which support people who experience multiple disadvantage, which is loosely defined as those who experience 2 or more issues relating to either homelessness or contact with the criminal justice system or addiction or domestic abuse or mental health struggles. And so the reason we chose that as a focus is because we know that these issues are relevant to all areas of public services, whether it's health or children's services or housing and so on. But it is through the lens of multiple disadvantage that we see these issues most acutely, because they're most likely to be passed around, and they're the ones who feel the impact when they are subject to services and systems which don't meet their personal needs. So to our knowledge, this work kind of signals the first attempt within the UK to bring together this range of actors to bridge that gap. And so I guess what I just described for you there is like the beginning part of our journey and kind of takes us up to the phase 2 of our work, which kicked off with a design sprint at the beginning of this year. Next slide, please. So back in March, as part of phase 2 of this work, we convened a cohort of public service providers, as well as inspectors and regulators, for a 2-day design sprint in Manchester to co-design experiments that could really enable more collaborative regulatory practice and better ways of working together. And within that design sprint, we really focused on 3 key areas. So the first was around myth busting, around real and perceived regulatory constraints and services. And that was really great because what we wanted to do was create a learning environment that felt non-adversarial. So bearing in mind, we've got local practitioners, we've got regulators in the room. We wanted to create a learning environment that was non-adversarial and truly enabled all the relevant parties to collectively learn about and dispel some of the myths that exist within the system. We also did some systems mapping, and that was really about unpicking and unpacking some case studies to understand what an ideal journey through services could look like, but specifically focusing on the lens of those experiencing multiple disadvantage. And then, of course, we got together because we were really there to co-design some ideas for experimentation. Next slide, please. And so one of the ideas for experimentation that the group came up with was to create a public service improvement partnership and a local operational task force. And this would be centred on the improvement of services for people experiencing multiple disadvantage in Rochdale. And the group would aim to bring together regulators and inspectors and practitioners and all the other relevant actors from across the system to form this public service improvement partnership. And through that partnership, they would aim to, first of all, collectively reimagine and experiment with alternative approaches to regulatory practices, but really specifically seeking to address some of the issues around accountability and collaboration and culture. And as part of this partnership, a local operational task force would be set up, crucially to ensure that the experiences and the voices of the people using the services are placed at the heart. And then they would also set up an action research programme, which would be initiated to really understand and disseminate evidence for better relationships between inspectors and providers. And I think it's in building this evidence base for collaborative approaches and good practices, the hope would be to foster an environment of active learning and sharing between the actors in the system that are currently working in silos. Next slide, please. And so this year, we've also been working on publishing our insights report from our action inquiry. And so what we've been doing is sharing insights from our action inquiry. And we have 4, I guess, key barriers that really came up as part of the action inquiry and what we did as part of our design sprint. And I think each of these insights really represent a missed opportunity for regulation to serve as the catalyst for learning across organisations and ultimately to improve public services. So the first insight was that the predominant approach to evaluating service performance focuses primarily on the providers instead of the experience of the people using the services. And I think the lack of focus on the experience of the people and their intersectional circumstances often results in inadequate responses to complex needs, especially for those who experience multiple disadvantage, who often require access to and movement between multiple services. So there's a need here to involve service users and their perspectives in the change processes to enable real public service improvement. The second insight that we had was that the current accountability structure, both in provider organisations and from regulators and inspectors, it doesn't really incentivise responsibility or positive risk taking. So there appear to be a bit of a mismatch between where power, responsibility and accountability sit, which can sometimes limit frontline professional opportunity to shape and meaningfully engage in service improvement. And so the idea that you would devolve more power at a place-based level would hopefully enable localities to respond better to the local needs and take ownership of their improvement. Our third insight was that a culture of fear and anxiety around inspection really hinders productive relationships and collaboration. So this fear-based relationship inhibits conversations and learning. And I think sometimes inspection can be linked to like criticism or anxiety. And I think there was like a real recognition that there needs to be a shift towards collaboration and trust and learning and productive working relationships between inspectors and practitioners to really allow regulation to enhance public services. And the fourth insight that came out was that ambiguity about the remit of regulation creates some of the myths that exist within the system and a culture of risk aversion amongst practitioners. So to dispel myths and empower practitioners to do the right things, we would really think that inspectors and practitioners should seek to collaborate more with each other beyond formal inspections to build genuine relationships and to build a collective learning environment. Next slide, please. So as part of this work, we also realised that we couldn't just focus at a local level, and that what we needed to do was also be talking at a national level too. Because I think if we recognise the nature of how power and permission works, it felt really important for us to be having a bit of a national conversation around this in tandem with the work that we seek to do, to really start to dig in and unpack around, you know, how do we create more generative relationships around regulation? What are the barriers that exist? You know, what does that say about the sort of accountability that we want to foster in public services? And what opportunities are there for true systems change? So last month, in partnership with GMCA, we co-hosted a roundtable event. So we convened senior leaders from national regulatory and inspection bodies and local and national government to explore how transforming relationships and practices around regulation can be harnessed for collective learning and innovation and public service improvement. And it was a really, I mean, first of all, it was amazing to have all of those incredible people in the room. But I think it was a really rich and insightful conversation that really shed light on 4 key themes that we think are crucial for shaping the future of regulatory practice. Number one, and it seems like a bit of an obvious one, but we'll say it anyway, regulation is just one part of the puzzle. I think the discussion really emphasised the need to view regulation and relationships around regulation holistically as part of a broader systemic structure. And that in order to address challenges effectively, like we must first consider its real scope and ensure there's clarity around the problems that are being addressed and the real need to explore alternative approaches beyond just traditional oversight or box ticking exercises. The second theme was around people with lived experience being uniquely placed to help us improve things. I think our conversation in the room really highlighted the potential of more person-centred and place-based approaches within regulatory practice. For example, like potentially involving service users in co-production when developing a new inspection programme was identified as a potentially valuable strategy. And also, interestingly enough, when we did our action inquiry research, we came across some interesting international examples of joint inspections that actually involved service users too. The third theme was around accountability and collaboration really going hand in hand. And I think attendees in the room really underscored the crucial link between accountability and collaboration when it comes to public service improvement. And so there were suggestions for how do we encourage more collaboration between regulators and inspectors and providers, like including how do we examine services across the system? How do we foster more joint inspection? And how do we create learning environments that bring different stakeholders together? And then last but not least, there was some interesting conversations around really shifting systems and like what could be some of the approaches and the conditions for change. So there was a call to shift from dictating outcomes to really understanding the needs of people using services and then tailoring your approaches to improve public service for different communities. And I think it's fair to say that essential conditions for driving meaningful change include, like, you know, cultivating mindsets of flexibility and adaptability, but also really supporting people to take positive risks from both sides of the regulatory relationship. And I think for me, this is where like the principles of human learning systems have been really critical yet implicit as part of our learning here. Because I think HLS has the potential to play such a pivotal role in creating the conditions that we need to enable collective learning and to enable the conditions that really enable systems to change. And so, yeah, that's kind of, that's just some of the work that we've been doing. Next slide, please. So in terms of what's next, I think at a local level, it's about taking the experiments and the ideas for experimentation from ideas to actual pilots. And I think at a national level, we need to continue the conversation because there really was a shared energy and commitment in the room as part of our national conversation. And I think no matter what seat people held, there was definitely a commitment to unlock the full potential of regulation as a catalyst for innovation and learning and improvement across public services. So next slide, please. So that's it from me. Thank you all for your time today, and thank you for bearing with me. Hopefully I don't sound too bunged up, but thank you. Back over to you, Elizabeth.
Thank you so much, Keisha. No, you don't sound bunged up. We could tell exactly, very clearly, and it had such resonance. I think you know, looking at this through an NHS lens and the role of regulators and the relationship that NHS providers have with the regulator, much of what you were saying there really, really resonated. So thank you for that. I'm not going to take questions direct to you, Keisha. I'm going to now invite Toby and Keith and yourself to join a panel and for people to put their hands up if they'd like to post a question. If it's just to the panel, could you say that? Or if it's to an individual panel member, please make that clear as well. So would anyone like to pose a question or sort of observation about what's been said so far? Is anyone involved in the work that Keisha was talking about in either Lancashire or Greater Manchester? And that we've probably got colleagues from those patches here now. No?
Could I ask a question, Elizabeth, even though I'm part of the delivery team? It's for you, Keisha, if that's okay, because in our breakout room, we had a fascinating discussion about how brilliant all this is, but how busy people are. And I know there's that phrase of people being busy doing nothing, but the fact that you got all those people in that room to do that work, sponsorship must be a vital enabler to kickstarting any of that so that you can come and start to deliver the wonderful things you're talking about.
Yeah, I'd definitely be inclined to agree with that. And I'd say that's why. And I mean, it's been, like I said, the journey started in 2020, right? Like we are now in 2023. And it's only in 2023 that we were able to do the design sprint and have the national conversation. So I think that is a real signal to the time that it takes to build the relationship, to build the permission space, but also to build the buy-in. But it's also really crucially why we felt it was important to have that national conversation, because whilst at a place space, people are really involved and engaged in it, like we also need the national endorsement and support and the continuation of opening up that permission space that really enables us to do this work and to do it well. So it took us 3 years to get here. So like kudos to the team, but like with all things, it takes time, right?
Absolutely, and I think we're all nodding away at that. So any other questions? Or Toby, you're going to come in on that point, were you?
No, I was going to say something different, but I see that Ruth has her hand up, so I'll.
Let's go to Ruth then.
Oh, hi. There was just a question for Keisha. I don't know, a couple of things, I suppose. In terms of regulators, do you think there's now momentum because things in a sense have got so bad in the way of some of our regulatory partners and some of the, certainly around, you know, Ofsted, in the way that that's now perceived and not nobody wanting to, you know, even let them in, and you know, that it seems like it's a mystery as to what, even with CQC, what they're going to ask for next, and it's kind of that, some of that conversation about, you know, don't even know what they're going to be looking for, so we have to have peer reviews to allow us to prepare, and there's a lot of work that goes into that. So I guess there's that in my thoughts, but also around language, and are there any thoughts around, you know, changing that kind of language around inspection even, and inspectors, and whether that might be something a bit more collaborative or proactive in the way of working together?
Oh, really interesting questions. I mean, to be fair to everyone involved, like I said, like Ofsted, CQC, they've been involved from 2020. So from the outset, they've had a really keen interest in working together to think differently about this. So what I would say is that there's been a genuine interest, and it has been ongoing and sustained, and they have been really committed to this learning journey with us. The question around language, I think, is really interesting, especially when you think about people use services and the people at the heart, and how language is used in different ways in different contexts. And so I don't have an answer to your question. I think that's a really interesting insight for us to actually bring to the group, and is really testament to the value in bringing different people together, because that's how you surface some of the differences in the context and the language that's being used in that space. So you've just given me more food for thought, actually, to bring back to the group.
Okay, thank you. So this is a two-way conversation, which is good. Toby.
Yeah, just to kind of pick up on that point about changing the language of inspection, because whilst the regulators view their role as kind of marking the homework of others and checking up on people, then that creates, that fundamental assumption creates some challenges for creating kind of genuine accountability in complex systems. Because the really, really important point that we have to remember here, so I often get asked questions about, but what about accountability in the kind of framings that we're offering? And I say, wouldn't it be great to have some accountability? Because the point to remember is that the evidence is really, really clear on this. At the moment, we do not have accountability. We have accountability theatre, where lots of people are making up data, and lots of people are putting on performances for when Ofsted and CQC arrives. That is not accountability. We do not have accountability right now. So the kind of change that people are talking about is absolutely necessary in order to create accountability. Because right now we're kind of pretending.
Okay, that's a provocation. I've got a question. I don't see any more hands up, but I just wanted to come back to the sort of OD question that was asked earlier, actually, and the sort of people development angle. So the people who are working with you on these pieces of work are learning skills, are having the opportunity to collaborate, build relationships, and you talked about some system leadership development. But how much do you think this sort of approach is weaved into classic people development opportunities within organisations, and is there the chance to do that better or to do it more in a different way? I'm not sure which of you would like to respond to that.
So I'm happy to say a few
Thanks,
words.
Gary.
So I think, I mean, if I think about our OD or HR departments, they're kind of really denuded. There are very few people doing loads and loads of work, but they're one of those nodal points in organisations, along with legal and procurement and commissioning and economic development, that we invested a lot of time in training around systems and complexity, because they can be very helpful if you're trying to move from one place to another. And it's part of this idea that no one is your enemy. They're a friend you haven't made yet, and you have to spend a lot of time getting alongside people. So all of us were doing the wrong thing at some point before we started doing this. And you just have to trust that if you expose people to the same things that moved you, they will be moved too. And my experience is that that's just generally true, because people in public service want to do good. in the world, and they're often conscious that they're not doing as much of that as they could under the current system.
Okay, thank you. So last call for any questions. No more hands up, and I don't think anything is fresh in the chat. So I see that you see the QR code that's popped up there. That's to invite you to post your evaluations. So if you would just take a moment to do that before we draw things to a close. So the link is there. You can use the QR code, 2 or 3 very quick questions. The results won't pop up on the screen. We'll collate those after the session is closed, and we take the feedback really seriously. We examine it closely, and it drives how we shape the whole masterclass series.
I do have the Alliance contracts here, if it would be useful to show people some stuff from that, how
Yes,
it differs
it
from a
would.
traditional
We do have
contract.
a little bit of time, actually. So if we could...
I'll try and share my screen. It's not always very successful because we're not allowed to use Windows.
Yes, you just haven't got Zoom, have you?
That might be it. Yeah.
And I think, Gary, did you say the example is of the Plymouth Alliance contract is up on the CPI website? Is that right?
Yeah, it is. But can anyone see that?
Yes, we can see. Yeah, thanks.
So I can't see it. I don't know what you can see, but is it moving when I'm scrolling?
Yes, we've just covered number 4 principles.
Okay,
so going up now.
Yeah, so
Down to
the bits that are different are the principles that I showed you on the slide, but also these principles about a group about being connected, a group about being asset based, but also things like looking for opportunity in risk, not seeing risk as a bar, that the person using the service is in control, that everyone is a citizen. So to move past this service-based constructions of people, so we talk about people, we don't talk about service users or that kind of thing, but also kind of, you know, this kind of represents what we're trying to achieve, what people can expect. So it's a kind of quite a different looking contract, and you can find that on the humanlearning.system site. I've put a link into the PDF case study for the Alliance, but I think you can actually get the contract, and I'm not sure if the agreement's there as well, the Alliance agreement.
Okay. And were the partner agencies involved in shaping the components of that contract? It does look radically different to the ones we might have seen elsewhere.
Yeah.
You're nodding, yeah.
I think the biggest thing is this thing where commissioners change when the world changes. So there's been 41 variations to the contract in the last 4 years because the world has changed.
Yeah.
And we need to change the contract. So it becomes a living document rather than a stick to beat people with when things aren't going well.
Yeah, that's interesting. That, you know, you hear about these arduous contract review meetings people have, whereas yours sounds a much more dynamic and constructive process. Thank you. Big thank you to all of our speakers. I think you've really stimulated our interest in our thinking and caused us to be even more curious on the subject. And thank you for generously sharing some of the material too, and links to sites and so on, including the contract, Gary. I think you've seen from the questions and the chat that this has really landed. We're all looking for a different way to work and behave in this complex environment, and you're outlining that for us. The case studies have really brought it to life. So Gary and Keisha, thank you so much. And Toby, thank you for setting the scene and for all your experience. It's been fantastic to have you with us. And a big thank you, as always, to the wonderful collaborative team who in the background sort out all of the arrangements for these series, find the speakers, work with the speakers and with all of the participants to make it happen. So you're unseen heroes in all of this. Best wishes for the festive season. I hope you all get a little break at some point. And it's been great to see you today. Bye-bye.
Thanks so much. Brilliant session.
Bye.
Thank you.
Thank
Bye.
you. Bye-bye.
Thanks,
very
everybody.
much. Thank you. Thanks. Bye-bye.